I want you to pause for a second and look down at your legs. Right now, as you are listening to my voice. Are your feet flat on the floor, planted firmly like the roots of a tree? Or is one leg draped casually over the other? Maybe your right knee is resting on your left knee, or perhaps you have your ankles locked together tightly under your chair. If you are like the vast majority of people, you are probably sitting with your legs crossed. It is a habit we learned in childhood. It feels polite. It feels ladylike or gentlemanly. It feels comfortable because it stabilizes your torso without you having to use your core muscles. But I am here to tell you that this seemingly innocent habit, this posture of comfort, is slowly wrecking your circulatory system. For those of us over the age of 60, crossing our legs is not just a posture, it is a tourniquet. It is a physical act of self-sabotage that spikes your blood pressure, crushes your veins, invites blood clots, and twists your spine. Today we are going to have a very serious conversation about the geometry of your body. We are going to explore why your doctor hates it when you cross your legs, even if they don't always tell you. We are going to look at the mechanics of the popliteal vein, the major highway of blood behind your knee, and what happens when you put a kink in that hose. We are going to discuss the terrifying phenomenon of false hypertension, where your sitting position tricks your doctor into prescribing medication you might not need. And we are going to look at the structural damage this does to your hips and back, leading to pain that you probably blame on arthritis but is actually caused by your chair. By the end of this video, you will likely never want to cross your legs again, and your heart will thank you for it. Let's start with the most immediate and dangerous effect, blood pressure. High blood pressure, or hypertension, is the silent killer. It is the #1 risk factor for stroke and heart attack in the senior population. We spend billions of dollars on pills, we watch our salt intake, we buy home monitors. But then, we sit down, we cross our legs, and we undo all that good work in a split second. Here is the physics of it. Your heart is a pump. Its job is to push blood down to your feet and then suck it back up against gravity. When you cross your legs at the knee, you are doing two things simultaneously. First, you are physically compressing the main veins that carry blood back to the heart. You are squeezing the tube. This creates resistance. Second, by elevating one leg and tensing the muscles to hold it there, you are increasing the volume of blood in your chest cavity because it can't stay in the legs as easily. Your heart senses this resistance. It realizes it has to work harder to push the blood through that tangled mess of limbs. So, what does it do? It pumps harder. It raises the pressure. Studies have shown that crossing your legs at the knee can increase your systolic blood pressure, the top number, by nearly 10 points. For some people, it spikes it by 15 points. Think about what that means. Let's say your true blood pressure is 135/85. That is borderline. Your doctor might say, let's watch it. But you walk into the doctor's office. You sit in the waiting room. You are nervous. You cross your legs to settle yourself. The nurse calls you back. You sit on the exam table. You cross your legs again because it's a habit. The nurse puts the cuff on your arm. The machine whirs. Because your legs are crossed, your pressure reads as 150/95. Now, you are in the danger zone. The doctor looks at the number. They don't look at your legs. They see 150/95. They reach for their prescription pad. They put you on a higher dose of lisinopril or amlodipine. They treat the number on the screen, not the person in the chair. You go home, you take the stronger medication. But now, when you are sleeping or sitting with your feet flat, your blood pressure drops too low because you are overmedicated. You stand up quickly to answer the phone, you get dizzy, you fall, and you break a hip. This is a catastrophic cascade of events that started simply because you crossed your legs during a test. This is why the American Heart Association and every nursing textbook in the world states clearly, measurements must be taken with both feet flat on the floor. But how often do we forget this at home? If you monitor your pressure at home, and you do it with your ankles locked, you are getting bad data. You are scaring yourself unnecessarily. You must uncross to get the truth. But the blood pressure spike is just the immediate reaction. The long-term damage is happening in the veins themselves. We need to talk about varicose veins and spider veins. Many people think these are just cosmetic. They think, oh, my legs look blue and bumpy, it's just ugly. No. It is not just ugly, it is structural failure. Your veins have a very difficult job. They have to carry used blood with no oxygen and full of waste products, from your toes all the way up to your heart. That is a long journey uphill. To prevent the blood from falling back down due to gravity, your veins have tiny little one-way valves inside them. Think of them like little trapdoors. The blood shoots up, the trapdoor slams shut. Shoot up, slam shut. This happens thousands of times a day. When you cross your legs, you are placing the weight of one heavy leg, which can weigh 20 or 30 pounds, directly on top of the other leg's knee. Right behind the knee is the popliteal vein. It is soft. It is vulnerable. When you rest your other leg on it, you are stepping on the garden hose. You are crushing the vein. The blood trying to come up from the lower leg hits a roadblock. It pools. It stagnates. The pressure builds up below the blockage. This pressure pushes against the walls of the veins. It stretches them out. Imagine a balloon that you overfill. It stretches. Eventually, the little trapdoors, the valves, cannot touch each other anymore because the vein is too wide. The valves fail. The trapdoor stays open. The blood leaks backward. This is venous insufficiency. The blood pools in your calves and ankles. The veins bulge out, turning into those ropey, purple, painful varicose veins. Your ankles swell. Your legs feel heavy and tired at the end of the day, like you are dragging cement blocks. This is not just aging. This is the direct result of sitting in a way that blocks the flow. By crossing your legs, you are literally strangling your own circulation. Let's go a step further into the danger zone, deep vein thrombosis, or DVT. This is the nightmare scenario. We usually associate blood clots with long airplane flights. They call it economy class syndrome. Why? Because on a plane, you are cramped, you don't move, and your legs are bent. But you can recreate economy class syndrome right in your own living room recliner. If you sit for 2 hours watching a movie with your legs tightly crossed, and you are dehydrated, and you are over 60, you are creating a stagnant pool of blood in your calf. Stagnant blood likes to clot. It turns into a gel. If a clot forms in the deep veins of your leg, it is a ticking time bomb. When you finally stand up and uncross your legs, the blood flow rushes back. It can break that clot loose. The clot travels up your leg, through your heart, and gets stuck in your lungs. This is a pulmonary embolism. It can be fatal instantly. It presents as sudden shortness of breath and chest pain. It is a medical emergency. And while genetics and other factors play a role, mechanical compression, crossing the legs, is a major risk factor that is entirely within your control. Why would you take that risk just to be comfortable for an hour? Now, let's move away from the blood and talk about the nerves. Have you ever sat with your legs crossed for too long and stood up, only to find that your foot is asleep? It feels numb, dead, or like it's being pricked by 1,000 needles. We laugh it off. We stomp our foot and say, "Oh, my foot went to sleep." But what is actually happening is nerve asphyxiation. There is a major nerve called the peroneal nerve. It runs right along the outside of your knee, very close to the surface. It is not protected by much muscle or fat. When you cross your legs, the top leg presses directly onto this nerve in the bottom leg. You are crushing the electrical wire that connects your brain to your foot. The numbness is the signal that the connection is severed. For a young person, the feeling comes back quickly. But for a senior, whose nerves are already healing slower, chronic compression can lead to permanent damage. It can lead to a condition called foot drop, where you cannot lift the front of your foot. You drag your toes when you walk. This massively increases your risk of tripping and falling. If you already have neuropathy from diabetes, crossing your legs is adding insult to injury. You are damaging nerves that are already dying. You need to protect every inch of sensation you have left, not crush it under the weight of your own thigh. We also need to look at the skeleton. Your posture. Your hips and your spine. The human body is designed for symmetry. We have 2 legs, 2 hips, a spine in the middle. When you sit with feet flat, your pelvis is level. It is like a bowl of water that is perfectly balanced. The spine grows out of the middle of the bowl like a straight tree. The moment you cross your legs, you tip the bowl. One hip goes up, the other goes down. You are forcing your pelvis into a tilt. Because the base of the spine is attached to the pelvis, the spine has to curve to compensate. You create a temporary scoliosis, a sideways curvature of the spine. If you sit like this for 15 minutes, it's fine. If you sit like this for 4 hours a day for 40 years, your body starts to set in this pattern. The muscles on one side of your back become short and tight, the muscles on the other side become long and weak. This is a leading cause of lower back pain in seniors. You might think you have a bad back because of a disc issue, but often it is just muscular imbalance caused by years of sitting crooked. The pain is usually on one side. It feels like a deep ache above the hip. This is your quadratus lumborum muscle screaming for mercy because you have been stretching it all day. Furthermore, let's talk about the hip joint itself. Greater trochanteric pain syndrome. That is a mouthful, but you might know it as hip bursitis. It is that sharp, burning pain on the outside of your hip that hurts when you lie on it in bed. When you cross your legs, you are stretching the gluteal muscles across the hip bone. You are pulling the IT band tight. This constant tension rubs against the bursa sac, the little fluid-filled cushion on the side of your hip. It causes inflammation. If you have hip pain, the very first instruction any physical therapist will give you is, stop crossing your legs. It is the #1 agitator of hip bursitis. I know what you are thinking. You are thinking, but it's so hard to stop. It feels natural. Why does it feel natural? It feels natural because your core muscles are weak. When you sit with feet flat, your abdominal muscles and your back muscles have to work a little bit to keep you upright. When you cross your legs, you effectively lock your torso into place. You create a tripod. It requires zero muscular effort to stay upright when you are crossed. Your body is being lazy. It is finding the path of least resistance. So, uncrossing your legs is actually a form of exercise. It forces your core to engage. It forces you to use your own muscles to support your spine. It might feel tiring at first. You might feel like you are sliding out of the chair. This is a sign that your chair is the wrong height or your muscles need waking up. There is also a social conditioning aspect, especially for women of a certain generation. You were taught that keeping your knees together and ankles crossed was the only proper way to sit. It was about modesty. It was about etiquette. Breaking a 60-year-old habit that is tied to your identity as a polite person is incredibly difficult. But you have to weigh etiquette against biology. Your veins do not care about manners. Your blood pressure does not care about being ladylike. The most ladylike thing you can do is stay healthy so you can be there for your family. You can still sit modestly with your ankles touching and your knees together, but keep your feet flat or simply tilted to the side. You do not need to stack the legs to be polite. Let's talk about the exceptions. Is crossing your ankles as bad as crossing your knees? The short answer is, no, it is not as bad, but it is still not great. Crossing at the ankles does not put pressure on the popliteal vein behind the knee, so the clot risk is lower. However, it still requires you to tense the muscles of the legs to hold the position, which can still raise blood pressure slightly. And it still twists the hip joint outward, which can irritate the hip socket. The gold standard is feet flat. But if you must cross something, cross the ankles, never the knees. So, what is the solution? What is the correct way to sit? We call it active sitting. First, adjust your chair. If your feet dangle, you will cross your legs instinctively to find stability. You need your feet to touch the ground firmly. If you are short, get a footstool. Not a poof to rest your legs on, but a flat stool to bring the floor up to your feet. Second, aim for the 90-90-90 rule. Your ankles should be at a 90-degree angle. Your knees should be at a 90-degree angle. Your hips should be at a 90-degree angle. This is the neutral position. In this position, the veins are open pipes. The blood flows freely. The spine is stacked. Third, use the backrest. Scoot your hips all the way back in the chair so your lower back is supported. If you slouch forward, you will want to cross your legs to counterbalance. But the most important rule of all is the motion rule. The human body is not designed to sit for 4 hours, crossed or uncrossed. We are designed to move. Even if you sit perfectly, gravity is still pooling blood in your feet. You need to use your calf muscle pump. Every time you flex your ankle, your calf muscle squeezes the veins and shoots blood up to the heart. If you are watching TV, every time a commercial comes on, uncross your legs and pump your ankles. Point your toes, flex your toes. Do this 10 times. Or better yet, stand up. Walk to the kitchen. Walk around the sofa. Reset the system. I want to share a quick story about a patient, let's call her Mary. Mary was 72. She was on 3 different blood pressure medications. She felt terrible, dizzy, tired, foggy. She went to her doctor every month, and every month her pressure was high, so he increased the dose. Finally, she saw a specialist who noticed something. Mary sat on the exam table, legs wrapped tightly around each other, chatting away. The specialist said, "Mary, put your feet flat on the floor. Take a deep breath. Wait 5 minutes." He measured her pressure. It was normal. It was perfectly normal. Mary didn't have resistant hypertension, she had crossed-leg syndrome. They lowered her meds, she stopped crossing her legs, and she got her life back. Do not let a posture habit dictate your medical treatment. I want you to be mindful of where you cross your legs the most. Is it at the dinner table? Is it while driving, crossing the left leg while the right uses the pedal? Is it while reading? Identify the trigger. Once you identify it, you have to break the pattern. It takes about 3 weeks to break a habit. You will catch yourself doing it. You will look down and see your legs crossed and not remember doing it. That's okay. Gently uncross them. Plant them flat. Take a breath. Remind yourself, open pipes. Open flow. Think of your legs as the roots of your body. If you twist the roots, the tree cannot get water. Keep your roots straight. Keep them deep in the ground. This connects you to the earth, it stabilizes your balance, and it keeps your plumbing working efficiently. This advice costs you $0. You don't need a gym membership. You don't need a supplement. You just need awareness. It is a small change, a micro adjustment, that pays massive dividends over time. It protects your heart, saves your veins, spares your nerves, and aligns your spine. So, I will ask you again, just like I did at the beginning. Look down at your legs. If they are crossed, uncross them now. Feel the blood rush back into your lower leg. Feel the tension release in your lower back. That is the feeling of health. That is the feeling of a body that is allowed to function the way it was designed. Sit tall. Sit flat. And keep that blood moving. Your body will serve you better and longer if you just give it a clear path. Thank you for listening, and here is to healthy circulation.